Happy Friday, everybody. Based on the number of messages and texts I'm getting, it must be time for an update. I keep putting it off, hoping against hope that this extension cord that I'm attached to, excuse me, will be off, and these coughing episodes will die down. But we're not there yet. Continue to learn so much on this journey, both mentally, emotionally, spiritually, and physically. I've had a good week. I've had a week of physical therapy and learned lots of hard lessons yesterday that as you begin to use large muscles like your hamstrings and glutes and your other leg muscles, your oxygen demand goes up pretty dramatically, and you don't really realize it until you need that oxygen and you realize that it's not there. But God has been gracious. I've been seeing a therapist, a wonderful woman who attends my church that I had not met but had been recommended to me, and she's been so helpful in teaching me to deal with the anxiety that comes along with breathing. Breathe through your nose, Isaac. And panic attacks, and that's really been amazing. Everybody always says it, but I'm going to say it. If you have never seen a therapist, you should see a therapist. Like, they can teach you more in an hour than you can learn your whole life, reading books and searching the internet and thinking about things yourself. So that's been extremely helpful. I did have my first follow-up with my doctor, Dr. Manchester, and she was absolutely amazing. I'm her fourth long-haul patient, and so she had lots of information for me on Wednesday, which I'll share with you. The best news of the day was that my lungs are moving air, which is an improvement. We've had some times where if I'm just sitting and not talking and not doing anything, I can take this off and my blood oxygen level stays in the high 90s. And so that was both encouraging and terrifying. I've been waiting for that day, but then when you don't have it, you begin to have the anxiety again. But I've learned a lot about just enduring those anxious thoughts and letting them pass, not jumping on them. Like a surfboard, just ride the wave. There's calm waters will come and we get past it. And so that's been extremely helpful. Dr. Manchester was very glad that I was seeking therapy because there's just the PTSD and the flashbacks, the mental, psychological, emotional, and spiritual aspects that come along with COVID are going to be a big part of my recovery. As far as the physical, I've got to stay on the oxygen until my oxygen stays above 90 when it's off. As you also saw earlier today, I get down into the 70s in a matter of minutes just from walking around the house, not even trying to walk outside where, as I learned yesterday, I need to slow down. I'll continue to see her every 2 weeks until my lungs are normal. And then she said this not to frighten me, but just as information that I should plan on seeing a physician every 6 months for the rest of my life. They're beginning to see in COVID patients that have recovered from 8, 9, 10 months ago, an increased heart disease, liver disease, kidney disease, as COVID is really a vascular disease. Everywhere where I had blood vessels, COVID went, and wherever COVID goes, it tends to destroy things. So we'll just have to keep an eye on it and make sure that we stay ahead of things, and knowing that research will continue to grow in this area, and there will be lots of hopeful things on the horizon. So that was informative and thought-provoking and encouraging. The physical therapy has been going well. It just has created a whole set of breathing issues that we have to work to get over. But ultimately, getting these muscles stronger will allow me to move using less oxygen. It's just, excuse me, getting them back into shape along those lines. So overall, it's been an enormously encouraging week. I appreciate all your calls and messages and notes and letters and prayers and thoughts. They're very encouraging and really do help me get through every day and get through every week. I was told over and over and over from the very beginning that if and when I recovered, that it would be a slow and painful recovery. And they didn't lie. It's definitely been both of those things. But as I continue to say, I'm a better person for having gone through this. You learn humility and you learn compassion, and you learn about your own strengths and powers and convictions. So I continue to be grateful to have survived the experience, and for the strength to press forward. And all of you out there are a big part of that. So thank you so much for all the positive vibes and prayers that you send my way. And we'll just continue pressing forward and look forward to the day when I don't have to wear this. But in the short term, I'm so grateful for it because it allows me to recover at home, and it allows me to walk Austin, and it allows me to work out in the yard as I'm able. So I will, as always, encourage you to please discuss the vaccine with your doctor if you have not been vaccinated. Talk to him about, or her, about the concerns that you have, and watch the videos that are out there. The technology behind it is really remarkable, and its success rate is remarkable. And if it prevents you from getting this, it will be worth it. Dr. Manchester's talked to me a little bit about what they're learning about why it affects some people differently. At this point, the research seems to be indicating that it is largely genetic and has to do with viral load. And so as they learn more about the genetic side of it, they'll be able to help people identify their risk level. And the viral load just has to do with, in all likelihood, I got this on the airplane and was sitting next to someone for 2 or 3 hours that had it. So if you bump into somebody at the store and you get a small amount of the virus, your body is probably likely able to fight it off. But if you are subjected to the virus for longer periods of time, obviously your risk goes up. So that's my information, and those are my thoughts for you, and God's blessings to all of you, and thank you for your continued support. I hope you all have a wonderful weekend. Bye.